On a cold December morning in 1791, the world lost one of its most brilliant musical minds. Wolfgang Amadeus Mozart, a prodigy whose melodies captivated Europe, succumbed to an unknown illness at just 35 years old. His untimely death left behind a legacy of unparalleled music and a persistent, haunting mystery. Subscribe to AI Daily News 100. Mozart's final year, 1791, was incredibly productive, yet marked by a noticeable decline in his health. He composed masterpieces like the Magic Flute and his Requiem Mass, pushing his creative boundaries. Despite this artistic fervor, his physical state was deteriorating rapidly. Reports from his wife, Constanze, and close friends describe a man increasingly plagued by illness. He suffered from bouts of fever, swelling, and severe pain. These symptoms became more pronounced as the year progressed, casting a shadow over his final compositions. Subscribe to AI Daily News 100. By November, Mozart was largely confined to his bed, his body racked with pain. The swelling, particularly in his hands and feet, grew alarming. He struggled to move, his once vibrant energy now completely depleted. The attending physician, Dr. Thomas Franz Closet, officially attributed Mozart's death to Hitziges fever, or miliary fever. This was a common diagnosis in the 18th century, often used for fevers accompanied by a rash. However, it was more a description of symptoms than a specific disease. Subscribe to AI Daily News 100. This vague diagnosis offered little clarity even at the time. It failed to pinpoint an underlying cause, leaving room for speculation and doubt. The medical understanding of the era was simply not equipped to identify the precise nature of his affliction. The lack of a definitive medical explanation fueled the rumors that began almost immediately after his passing. People sought a more dramatic or understandable reason for such a monumental loss. The official cause felt insufficient for a genius of his stature. Subscribe to AI Daily News 100. One of the most enduring and dramatic theories points to poisoning, with fellow composer Antonio Salieri as the alleged culprit. This narrative gained traction in the years following Mozart's death, popularized by Pushkin's play and later by the film Amadeus. The story painted Salieri as a jealous rival. However, historical evidence overwhelmingly refutes this claim. Salieri himself denied any involvement, and there is no credible proof linking him to Mozart's demise. The two composers, while rivals in some respects, also showed mutual respect and collaboration. Subscribe to AI Daily News 100. Mozart's own letters and contemporary accounts do not suggest he feared Salieri or suspected foul play from him. The poisoning theory is largely a romanticized fabrication, a dramatic narrative that overshadows historical fact. It serves as a testament to the power of storytelling over truth. A more medically plausible theory suggests Mozart succumbed to complications from recurrent rheumatic fever. He had suffered from this illness multiple times throughout his life, starting in childhood. Rheumatic fever can cause long-term damage to the heart and kidneys. Subscribe to AI Daily News 100. Symptoms like fever, joint pain, and swelling are consistent with rheumatic fever. Repeated attacks could have severely weakened his heart, leading to heart failure. This would explain the edema and general decline observed in his final months. Many medical historians consider rheumatic fever a strong contender for the true cause of death. It aligns well with the documented symptoms and Mozart's known medical history. The cumulative effect of the disease could have finally overwhelmed his system. Subscribe to AI Daily News 100. Beyond rheumatic fever, several other medical conditions have been proposed. One theory suggests acute glomerulonephritis, a kidney disease often triggered by a streptococcal infection. This would explain the severe swelling and kidney failure. Another hypothesis points to trichinosis, a parasitic infection contracted from undercooked pork. Mozart was known to enjoy pork cutlets, and the symptoms of trichinosis can include fever, muscle pain, and swelling. This theory, however, lacks direct evidence. Subscribe to AI Daily News 100. Some researchers have even considered complications from a strep throat infection. Such an infection could lead to rheumatic fever or kidney issues. The interconnectedness of these conditions makes a definitive diagnosis challenging without modern medical tools. The medical practices of the late 18th century also played a role in Mozart's final days. Treatments like bloodletting, a common practice, were often more harmful than helpful. It could have further weakened an already ailing patient. Subscribe to AI Daily News 100. Mercury compounds were also used as medicine, which could have exacerbated his condition. The lack of sterile techniques and effective antibiotics meant that even minor infections could become life-threatening. Medical interventions were often rudimentary. The physicians of the time, despite their best efforts, operated with limited knowledge of disease pathology. Their treatments were based on prevailing theories, many of which are now discredited. This context is crucial for understanding Mozart's medical care. Subscribe to AI Daily News 100. Crucially, no formal autopsy was performed on Mozart's body. This absence of a post-mortem examination is the primary reason for the enduring mystery. An autopsy would have provided invaluable insights into the exact cause of death. The lack of an autopsy was not unusual for the time, especially for someone of Mozart's social standing. However, it means that all modern diagnoses are based solely on historical accounts of his symptoms. These accounts are often subjective and incomplete. Subscribe to AI Daily News 100. Without direct pathological evidence, any conclusion about Mozart's death remains speculative. We are left to piece together clues from fragmented historical records. This makes the task of solving the mystery incredibly difficult. In recent decades, medical historians and researchers have revisited Mozart's case with modern diagnostic tools and knowledge. They analyze the documented symptoms against contemporary medical understanding. This allows for more informed hypotheses. Subscribe to AI Daily News 100. Studies have meticulously reviewed letters, medical records, and eyewitness accounts. They compare Mozart's symptoms to known disease progressions. This rigorous approach helps to narrow down the most probable causes. While a definitive answer remains elusive, these reevaluations have largely dismissed the sensational poisoning theories. They instead focus on more mundane, yet equally tragic medical conditions. The scientific approach seeks truth over drama. Subscribe to AI Daily News 100. Ultimately, the precise cause of Wolfgang Amadeus Mozart's death remains an enduring historical mystery. The available evidence points towards a natural, albeit tragic, medical condition, likely exacerbated by 18th century medical practices. While the romantic notion of poisoning persists in popular culture, the weight of historical and medical analysis leans elsewhere. His death was likely a culmination of chronic illness and the limitations of medicine at the time. Subscribe to AI Daily News 100. Mozart's untimely demise at 35 deprived the world of countless more masterpieces. Yet the music he left behind continues to inspire and move generations. The mystery of his death only adds another layer to the legend of this extraordinary genius.